Are you looking for an effective way to prevent high blood pressure, obesity, and high cholesterol? Cardiovascular exercise is one of the most powerful tools available to improve your heart health and overall well-being. Cardiovascular, or cardio, exercises are activities that increase your heart rate and keep it elevated over time. This strengthens your heart muscle, improves blood circulation, burns calories, and positively impacts your cholesterol levels. According to the American Heart Association, engaging in at least 150 minutes of moderate intensity aerobic activity per week can significantly reduce the risk of heart disease and stroke. That's just 30 minutes a day, 5 days a week. Regular cardio workouts help lower both systolic and diastolic blood pressure. In fact, a meta-analysis published in the Journal of Hypertension showed that aerobic exercise can reduce systolic blood pressure by 5 to 7 mmHg. Additionally, cardio helps lower LDL, bad cholesterol, and raise HDL, good cholesterol. It also aids in weight management by increasing energy expenditure and improving insulin sensitivity. So what are the most effective cardiovascular exercises for preventing lifestyle-related diseases? 1. Brisk walking. Walking at a moderate pace is an excellent entry point for beginners. Just 30 minutes a day can lead to measurable reductions in blood pressure and belly fat. It's low impact and easy to fit into your daily routine. 2. Jogging or running. These exercises elevate your heart rate quickly and help improve cardiovascular endurance. They're effective at burning calories and boosting your VO max, which is a strong indicator of heart health. 3. Cycling. Whether it's on the road or a stationary bike, cycling is a joint-friendly cardio option. Studies have shown that regular cycling can reduce the risk of heart disease by up to 40%, while also improving overall metabolic health. 4. Swimming. Swimming is a full-body, low-impact workout. It's especially beneficial for those with joint pain or obesity. It increases lung capacity, reduces resting heart rate, and improves cholesterol levels. 5. High-intensity interval training, HIIT. HIIT involves alternating short bursts of intense effort with brief recovery periods. It's extremely time-efficient. Just 15 to 20 minutes per session can produce significant improvements in blood pressure, weight loss, and insulin response. Combining cardio with resistance training yields even better results. Lifting weights helps you build lean muscle, which increases your resting metabolic rate. This combination enhances fat loss, improves blood sugar regulation, and supports long-term weight management. Now you might be wondering, how can I apply this to my life? Let's explore some practical tips, especially for busy professionals and older adults. For office workers and busy professionals, break it into chunks. You don't need one 30-minute session. 3 10-minute brisk walks during the day still count. Commute actively, park farther away. Get off one stop earlier or bike to work when possible. Lunchtime laps. Use part of your break to walk or climb stairs, even indoors. Desk workouts. Try chair squats, standing marches, or resistance bands at your desk for a quick 5-minute cardio burst. For seniors and older adults, start slow, stay steady. Begin with 10-minute walks, gradually increasing duration and pace. Try water aerobics. It's gentle, on joints, and great for cardiovascular conditioning. Use a step counter. Setting a daily step goal, even 5,000 steps to start, can build long-term habits. Balance and flexibility count too. Combine cardio with light stretching or Tai Chi to improve circulation and prevent falls. It's important to consult a healthcare provider before beginning any new exercise program, especially if you have chronic conditions or have been sedentary for a while. But once you start, the benefits often come faster than expected. Studies even show that regular exercise can be as effective as some medications for managing blood pressure. A 2018 review in the British Journal of Sports Medicine concluded that exercise interventions were just as effective as commonly prescribed antihypertensive drugs in reducing blood pressure. This doesn't mean you should stop taking prescribed medication, but it does mean that movement is powerful, and in many cases it can reduce the dosage or delay the need for medication with your doctor's guidance, of course. Cardiovascular exercise is not about punishing your body. It's about building a stronger heart, better circulation, a clearer mind, and a healthier life. So whether you choose walking, cycling, swimming, or something more intense like HIIT, the most important step is simply to start and keep going. Your heart will thank you for it.